Hey everybody, this is Greg with Medical Muscle. And in this video, I want to go over what my experience has been like doing clinical rotations as a St. George student and how it compares to the first 2 years of your basic sciences. So there are some differences. Some ways it's harder, in some ways it's slightly easier. So if you've noticed, starting from term 1, it progressively gets harder and harder and harder until term 5 is probably the hardest term on the island. Well, guess what? Clinicals is slightly harder. Slightly, though. There's some things that are slightly easier. So let's start with that. So what is easier in clinicals than in your basic science years? Well, I think in general, the lectures are easier. I'm going to say that. The lectures are easier. The material is just not as scientifically heavy as you're covering in the first 2 years. It's more clinical based, obviously, because that's what you're doing. So it's nice. It's more hands-on. It's more like, how do you now use these tools, these skills that you have to diagnose a patient, or what's the next best step kind of questions, ethical questions added in with there. Obviously the sciences, you still need them, but the lectures and the questions that I'm covering in clinicals assume that you already know that, and that we're now going to ask you the next question on top of that. So yes, the hands-on real life application makes it a little easier, especially because you're in clinicals and you're doing a lot of the things that they're discussing in these videos, okay? And the videos that St. George gives out are just YouTube video links. They're just suggested videos to cover on certain topics. And because it's applicable to what you're physically learning, I feel like there's a lot of reciprocal learning. You're learning it through the videos, and then you actually learn it in real life, potentially with one of the patients that you're working with, and then it kind of helps everything, okay? So there's that. The amount of hours that you're doing lecture can be pretty low. For EM, we have 5 hours a week in person in the hospital, and that's just in one day. So that's kind of cool. It's much less than the 2 hours that you got to do every day, 5 days a week on the island. Now, I'm going to say in general, though, there's a lot of ways that clinicals are more challenging, okay? So you're going to be putting in a lot of hours just in the hospital. I'm not adding in the hours that you need to study outside of that, because it just adds on it. So the amount of study time is probably a little less. The amount of questions you got to go through, the lecture material, it's probably less than what you're doing on the island. But that's added on top of doing a full 8-hour shift. Sometimes you get out early, sometimes it's only like 6 hours for some of these rotations, but for the vast majority, it's a full 8 hours, sometimes 10 hours, depending on the rotation. If you're in surgery, you're going to be doing at least 8 to 10 hours, somewhere around there. I'm going to say that. And in some instances, it's impossible to study during that period. So your only option is to study outside after hours, right? Like I'm in the emergency medicine rotation. There's zero time to study. I don't have any time to study. We're moving nonstop. Either I'm seeing patients by myself, I'm reporting the information, I'm looking at the computer, I'm looking at the patient's charts. I'm doing things for the doctor. They asked me hey, could you get this patient prepped? And we need this, them in that room so we can do this physical, all that stuff. You're moving pretty much the whole time. I know that's not, what you would experience with every single rotation, but that's what I've experienced so far. The other big downside is, you're going to start doing a lot of weekends, more weekends than you'd like. So luckily for emergency medicine, yes, we do weekends, but then we get weekdays off, depending on how the rotation goes. But there's some shifts that require you to work 5 days in a row, and then, you'll have to occasionally do a weekend. So that's 6 days. That's a lot of hours to put in, and that's not including putting in study hours, okay? So time management is going to be very important, very important. It's less of a mess around time. I feel like in the first 2 years, you can mess around a lot more. There's a lot more free time. Potentially, this is far less free time than you had prior because of the amount of hours that you just have to designate just to showing up to the hospital. All right. And you do, I mean, some people, do study during their shifts, but I've heard that they get scolded for that, because it looks like they're not wanting to participate in the clinical skills stuff. Okay. So, you're damned if you don't study and you're damned if you do, because then it'll look like you don't care about what you're studying to the doctors that are in charge of you. So there's that. It can be emotionally draining too, because yes, you're doing weird hours. I had to do overnights, which was not the most fun thing ever. I couldn't get used to it. I did start to get used to it at the end, but it was tough going to bed when the sun is rising and then waking up and the sun is setting. It's a very kind of depressing feeling for a week. So there's that, and it messes with your whole, exercise or grocery schedule, all that stuff. It can be emotionally draining in the fact that you see some really sick patients. You see a lot of sick patients. You see patients die. I've seen a handful of patients die. I've seen a handful of patients get newly diagnosed with cancer. And that can be very hard. It can be very hard for a lot of students. You see blood, you see trauma, you see abuse, you see feces. You might get feces on you, you might get vomit on you, you might get blood on you. I'm not trying to scare you, but that's the truth. You're gonna be exposed. You're exposing yourself to a lot of sick people. You're gonna increase the chances of you getting sick, right? So I've already been sick way more often than I've ever been sick in the last month. I just got like colds and stuff and sore throats. No COVID yet, but every patient that comes in there, especially now because it's getting cold and it's the flu season, people are coming in and they're exposing me and all the doctors. Everybody else is sick, so it's that's kind of a pain in the ass. But I think all in all, I do have to say that I don't want to make it sound like it's a horrible experience, because it's fantastic. It's just reminded me that this is exactly what I want to do. It's fun. I find it fun. It's fun learning. That's the benefit. Okay. I don't want to say, okay, it's 8 hours and it's grueling. No, it's all interesting. I get to see really cool things. I get to see people with diagnoses that I've only read about, in the first 2 years. And now I actually see this presentation. I'm like, oh, this is what this looks like. So that's really cool. That's really cool. It really kind of shows me that this is what I want to do. And I hope that that's an experience for you. Not for everybody, some people just dislike certain rotations, and I probably will too, but so far I'm really enjoying it. I'm going to say that I do look forward to going into my shifts. So, and it's not all that bad. Okay. I would say the other thing is, you don't have a test every 3 to 4 weeks. I think 5 weeks was like the longest that you go on the island. For clinicals, you're doing them every 6 weeks. So you're studying day one for these 6 week long rotations. At the end, you take your shelf exam. It's about the same length as your block exams on the island. Like 3-ish hours, 3.5 hours, something like that. So it's about the same in that regard. You're really studying doing questions. So yes, your workload in that capacity is lower. What's the other downside? Oh, you guys are going to love this. One of the huge downsides is that you got to treat this it's more like a job. Okay. So on the island, I know a lot of people would just not show up to lecture or just not show up to a small group, and you're allotted, 20% of the total participation you can miss. Clinicals, you can't take off any days. pretty much ever. If you do, you're going to either have to make that up within the clinical rotation, which hopefully in that rotation they allow you to do that. Like EM, emergency medicine, I can change my shifts. That's possible. I'm about to go into OBGYN. I may be able to do an extra weekend shift to make it up, but not all of them have that opportunity. So if you are sick or you need to take off more days than you thought, you're going to have to either make those days up, and if they don't give you that option, then you're going to have to redo that clinical rotation, and it's going to delay your ability to take step 2. So it's more like a real job. I think it's going to be a big shocker to people who are not used to not being able to just not show up if they don't want to. You have to show up every single day. There's no ifs, ands, or buts. You got to show up early. You got to show up early. You got to leave when they tell you. You can't just leave whenever. And it's like a real job at this point. And I think that is, another. It's not hard for me because I had a full-time job before I started this. So now it just feels like I was working. But for people who haven't worked a real job, good luck. And then it's a real job plus studying on top of it. Okay, so that's a lot. All in all, when you're with the doctors, try to be as professional as possible. I want you guys to be, very serious, study, because then when they quiz you, they're going to ask you questions. And if you look stupid, it just makes you look bad. They're going to put it on your eval that I quiz them on this thing. They're not that great. You want to be sharp. And then when you are sharp, you get these great evals, so you got to stay on your shit. You got to act like you like this, you care about it, and you're willing to go out and do whatever they ask. If they ask you, hey, can you go get a suture kit and start prepping this patient? Bam, you're doing that. If they ask you, hey, can you go interview these 2 patients real quick? Can you get a quick history from them? Boom, do it. Get up, go be proactive. Because potentially these people are going to write a letter of recommendation for you. So you want to really shine. Yeah, I think all in all, there's good doctors and there's bad doctors in probably any field, but I would say that you just gotta be personable, get to know people, and you'll find that I've had a great experience so far. I've only had like one bad instructor so far. The rest have been fantastic. I think it's been a great learning environment. I can ask a ton of questions. Obviously you gotta understand that you're there, you being present with these doctors is slowing them down. Okay, it's like you're kind of slowing them down from doing their job potentially. So be helpful when you can, but in general, you don't want to be in the way. You want to just be helpful and then let them get their work done. So you don't want to bombard them with too many questions. You want to let them, get their notes in and everything. But be ready, be diligent, be ready to go when they ask, and it gives you great evaluations. They really appreciate that because it helps them. All right, guys. I hope that was informative, and I hope your tests go fantastic.